You are watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, hot topic, big topic. This is a good show today. We've got a board-certified plastic surgeon that everybody's talking about, great reputation. Mommy makeovers that, we talk a lot about on our show about looking 10 years younger with facial rejuvenation. Now, this doctor says you can look 10, 15 years younger from the neck down with tummy tuck, liposuction, breast augmentation, or lift. My advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Hot topic today, mommy makeovers. With us we have the most popular, probably the busiest board-certified plastic surgeon in California. With us we have Dr. Mo Zakhireh. Dr. Zakhireh, welcome to the program.
Thanks, Randy. Good to be here.
And now you've been, you took over CSI, the
Yes.
Cosmetic Surgery Institute, how long ago?
In January of this year,
January.
2008.
Good, and you're very
Took
busy.
over, and we're 8 months into it and doing great.
Big facility. How big is that? You have a couple of ORs?
Yes, it's a total of 6,300 square feet, a couple of operating rooms accredited by actually 2 different bodies from the state of California. We have a total of 14 employees. We were able to keep the whole team together, and to me that was very important to have the same people that were assembled. So everybody's doing really good.
I've met them all, happy group of people.
Yep.
And now for those that don't know you, your background, pretty impressive background, great story. University of Utah, tell me about that.
Well, originally I did my medical school in Texas at Texas Tech, and then I did my general surgery residency at Harbor UCLA, the county hospital for UCLA in Torrance. And then I got recruited by the University of Utah to do my fellowship in plastic surgery. And they were impressed enough with me and kind enough to invite me to stay on as faculty staff. So I stayed on as a professor of plastic surgery and taught medical students and residents and fellows for almost 5 years at the University of Utah before being recruited by a group to come to the desert.
Did you always know you wanted to be a plastic surgeon?
No, I didn't.
And when did you know?
You know, it's funny, Randy. In growing up, I was always with plastic surgeons and ENTs because one of my family members was born with a congenital abnormality.
Okay.
She was born without an ear, so she had her ear reconstructed. And to me, I was always in awe. I mean, I looked at those people, I looked up to them as they were gods. And I didn't really think that I had the muster to be a plastic surgeon, but I always strived to become one, so I went to medical school, then I went into residency and just worked hard. And
You knew you wanted to be a plastic surgeon?
I would love to be a plastic surgeon. I just thought.
But in medical school, though, you knew you wanted to be a plastic surgeon?
Well, in medical school, I knew that I wanted to be a surgeon.
Okay.
So it just kind of developed in me, to become a plastic surgeon. So.
You come from a family? You have doctors in the family?
I have my younger brother who is a doctor, and actually my sister owns and operates a day spa in Salt Lake City, Utah.
Okay.
And she's a master esthetician, and my mom also owns and operates an Aveda beauty salon, actually in Rancho Mirage.
Now today we're going to talk about liposuction and tummy tuck, which is what you call a mommy makeover.
Yeah, actually I brought an array of pictures for you from different patients, liposuction, tummy tuck, and then this new procedure combination that we're doing, which is a combination of liposuction, tummy tuck, and breast work for the moms who have gone through breastfeeding and have lost a little bit of volume in their breasts, so they come in and they're wondering if they need a lift or a augmentation, things like that. So we do some breast work on them also.
Now you do everything, though. I mean, you do facelifting. I mean, is that right? Is there anything you don't do? I mean,
There's 4 main procedures that I do now: facelifting, tummy work, liposuction, and breast work. And I think if anybody asks me, which one of those surgeries do you like better, I really can't tell. I love all 4 of them. I cannot do without any of them. We do everything that I do excellent on, and I really enjoy doing it.
And you're a perfectionist still.
Yes,
you feel
definitely,
that way.
Definitely a perfectionist. Sometimes I get on my own nerves, but
okay.
Yeah, I think it's very important in my line of work and what we do. It's very important to be a perfectionist. You got to pay attention to the small details. You got to pay attention to that belly button, or to the placement of the nipple areola complex, to the breast crease. It's all the little details that make the big picture look that much more beautiful.
Okay, who is the typical patient that comes in for this mommy makeover? What are the age ranges?
Well, you know, I mean, we have an array of people coming in actually for the mommy makeover. It started out as, you know, one of my own personal friends, a young lady who is the wife of one of the local physicians in town. And we were talking, and she was like, you know, I have had a great body. I've had 3 children now. I just feel that I just need that pick-me-up, and I'm getting depressed. You know, I have a little bit of extra skin. When I bend over, it sags, and then my breasts are sagging. You know, what can I do about it? I said, you know what, come on in. Let me have a look at you. I did a consult on her, and you know, I said, gosh, you just got the muffin tops. We just liposuction that, you know, tighten up your abdominal muscles, pull that extra skin and cut it out, and do the breast augmentation, you know, all in the same sitting. We did that for her, and what happened with her is her self-confidence just developed, and she just got back all the self-esteem.
So they get their self-esteem back.
Absolutely. And you know, they always say, you know what, I've had my kids, I've paid my dues, you know, this isn't for anybody else but me. It's not for my husband, it's not, you know, my husband is very happy with me, he's very supportive either way. I just want my old self back when I look in the mirror, which is very important.
Because they will look younger, you're saying. I mean, you don't have to have a facelift to look younger, but you could return their body
absolutely
back to when they were in their 20s.
Absolutely. And
is that right?
Actually, some of them even say that their body looks better now than it did before they got pregnant, and the reason being is that with the liposuction combination tummy tuck, not only are you sculpting the sides and the flanks, but you're also tightening the muscles, which brings in the waistline, and it gives them that hourglass shape that some of them have never really enjoyed. You know, some of the women, you know, are sort of a little bit square, and so when you tighten everything up, they get that hourglass waistline, and they are so thankful.
So young 30s, early 40s?
So that subgroup is in their young 30s, early 40s, and then, you know, we have some ladies who come to us in their 50s or even their 60s, and they're like, oh my God, why didn't I do this earlier?
Now 40 and 50, of course, is very young today. And we've talked off camera. You say that sometimes they get a second chance. I mean, we talk a lot about in facelifting, looking 10 years younger, 15 years younger, but do people say that? I feel like in my 20s again? I mean, do they ever tell you that?
Absolutely. Well, you know, it's funny that you ask, because I think people always feel like they're in their 20s. The thing they say is, you know, in my heart, I feel like I'm 20, but my body doesn't show it. And so it does something to them when they look in the mirror, they start to buy into that. And so they say, you know, I want you to bring that back out in me.
So in your consultations, because this is a very private issue, I mean, you look at their tummy, their breast, you do this alongside an RN?
Yes.
One of your assistants?
Right. We usually, what I do is either an RN or a chaperone, like for example, Becky, our patient care coordinator, comes in with me.
Okay.
I look at the patient and I get excited about their results, because we can envision them.
So you see the end results. I mean, when
Absolutely.
you see somebody there in front of you, you say, boy, this can be great.
Yes. And it's very important, because I allow the staff, I give the staff leeway to give me input.
All right, so they put their input with you.
Absolutely.
Kind of getting together as a team and saying, hey, you know, what about this, Dr. Zakhireh?
Absolutely. It's very important to give them leeway to give me feedback before surgery and during surgery.
We're going to take a quick break. We come back, these photos. And good-looking photos. Good work here. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We are here with the hottest plastic surgeon in the desert. And up next, mommy makeovers, some very revealing photos that as Dr. Zakhireh says, you could take a 40, 50-year-old body, make it look like somebody in their late teens. Is that right? Okay. Yeah. And you could be the judge. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, mommy makeovers. We're here with plastic surgeon, board-certified plastic surgeon, Dr. Mo Zakhireh. Now, you're one of the guys in the desert that has a really good reputation.
Thanks.
Why is that?
I appreciate that. I think mainly because I take pride in my work. I take it very personal, and you know, it's my passion, so I'm very fanatic about it. I think the most important part is that I keep growing with my work. Okay. Now I've gotten to the point where I truly am comfortable with my work, and I look at my patients as a canvas.
Okay, and we're talking about mommy makeovers. And for people just tuning in, define the mommy makeover.
Usually what happens during pregnancy, number one, as a result of multiple pregnancies, the abdomen stretches out, the skin of the abdomen stretches out, and the abdominal wall, the muscles. Those are the things that take place.
Liposuction, tummy tuck is usually the combination you're doing for a mommy makeover.
Right. And
you're giving them their body back.
Absolutely. And actually, Randy, this is funny. The newest thing that I'm doing, a lot of the mommies are coming to me now and saying, you know, my butt has started to sag. What can you do about that?
So what can you do for that?
Well,
buttocks that is starting to fall.
The thing that I do, I approach it by, when I suck out the fat from the love handles, let's say, we spin it down, we purify it, and I re-inject it into the buttock area, very deep, close to the muscles, so that the blood supply from the muscles, which is very rich, comes up and grabs the fat branches that you're introducing.
Did you get a lift?
And the fat actually lives, and it perks up that that butt area, because, you know, you're increasing the contents in essence. But it's actually their own natural fat, so it's really nice, and it feels like their own natural fat because it is its own, you know, their own natural fat.
Now you brought some photos. What are we looking at here?
This lady came to me. She's a mother of 3 children. She said, "Doctor, I look great. I feel great, you know, with my clothes on. But when I have no clothes on, I look in the mirror." She pointed straight to her pubic area and to the belly button area, where she has all these stretch marks from, you know, multiple pregnancies. You know, her skin got stretched out, the abdominal area got stretched out.
So a little wrinkle, kind of wrinkly around the belly button.
Absolutely.
Wrinkly above the bikini line.
Extensive stretch marks. And also she said, "Can you do anything about my breasts?" So what I did for her is we did the tummy tuck, and I lipo-sculpted the love handle area to get rid of the muffin
Very nice,
tops.
very fit looking.
Yes, we tightened the muscle. We gave her a very nice looking athletic abdomen. We reconstructed her belly button, and we did a breast augmentation on her. In the oblique view, you can really tell, you know, how she's
So the side view,
happy.
when we put these side by side, huge difference.
What I want you to notice is that this lady had a little bit of a pannus. You know, her belly was just hanging before the surgery. After the surgery, her belly is absolutely flat, very athletic looking abdomen. You have to also look at the waistline. The buttocks are very full, and the breasts. So what happens with these patients is this is a transformation that takes place, and it's a subconscious transformation, where as before she was afraid of wearing bathing suits, not even a one-piece. Now she's very comfortable wearing a 2-piece bathing suit, goes to the pool, goes to the beach. These were true fears.
Yeah.
She was afraid
it's
of
a very pretty look. I mean, it's a
you know,
fit look.
So absolutely. And these people, what happens is, as we watch them, they come in, their makeup pattern changes,
they start
their
acting
hairstyle
differently.
changes, and they have their full self-confidence back.
Is that right? Okay.
Now, this second patient is very important to also listen to the patient as they come in. Okay. You know, Randy, when women wear dresses, it's so important for them, especially the midriff area, the flank area, to look very nice and smooth, you know? And so it takes just a little bit.
And women are hard on themselves. I mean, just a little bit of a...
Absolutely.
They think they look fat when they look fantastic.
Absolutely. And so it just takes just a little bit of extra hard work on my part to make them look smashing in a dress. And I want you to look... This lady did not specifically want a tummy tuck. She wanted a liposuction. And the way her waistline was brought out, and I actually...
She looks 20 pounds, 30 pounds lighter.
Absolutely. And these patients...
But she's not 30 pounds lighter.
Well, no, but what happens is they lose inches, and actually they get motivated and they go to the gym and they lose 20 to 25 pounds.
So this gives them the leverage.
Absolutely.
Do you feel like you're changing people's lives? I mean, is it rewarding to you?
You know, I don't really, half the time I don't realize what I'm doing until the patient comes back, let's say a month out, you know, and they are in tears, or they write me a really nice card and they tell me what I've done for them, and it's so touching and it's very heartfelt, you know. And yeah, I mean, I'm honored to say that we do change people's lives. Now, this is the same patient from behind. Very important to look at her before and afters, because
I'm not trying to be too obvious here. I'm on your side, but this is really good work.
Thank you very much. Now, at the same time, I got to tell you, these are the kinds of patients that we refer for hormone therapy, because, you know, you look at this patient's mid-body and midriff area, and they get very heavy here because of hormones. So it's very important, again, to have that multi-pronged approach. Send them for hormonal counseling, send them for nutritional counseling, and also, you know, send them for, you know, formal trainer who knows what they're doing. Basically, to sum it up for you, this lady actually came in and asked to look good in her clothes, but I actually was able to make her look great in a bathing suit. She enjoys putting on a bathing suit.
The rear view doesn't look like the same woman.
Exactly, and we surpassed her expectations, and that was key to me. That made me feel really good. This story is dear to my heart. This patient, the third patient that I'm going to show you, I did a combination of liposuction and tummy tuck on her.
Is that rare to see this type of situation?
Actually, you know, it may be rare for you, but it's not rare for me. The problem is these people become inward. You know, they develop a shell after a while. they get very depressed. They don't talk much. They don't leave the house much. By the time they actually come to see me, I mean, they kind of walking, kind of hunched over with their head down because they're so depressed.
Wow.
Now, Randy, when this lady came in, I looked at her and I thought, oh my God, this is a perfect tummy tuck patient. A little bit of liposuction of the back and also the abdomen and a tummy tuck. I mean, look at her. Before she had such a pannus, you can't even see, you know, her underwear. Look at this side view. I get so excited about this lady. Do you think she was able to put on a dress before or even pants after this? No. And now she can wear anything she wants. Very important. She lost 8 to 10 sizes after the surgery within 21 days.
This is a mommy makeover.
Well, I didn't do anything on her breasts. What I did on her is we liposuctioned and then liposculpted her sides and her back. Very important also, I got to show you the kind of rolls that she had. These rolls women hate. The bra strap rolls,
the rear view.
When they wear a dress, you know, all these rolls show up. So we were able to get rid of all these rolls, make her nice and smooth, and just, I can't really say enough about her.
Now, we're out of time. Time flies when we have you on the show.
Ah, boy, I'm sorry. You know what? Let me just go over a few more patients with you. I think this is very important.
Mommy makeovers.
Mommy makeover. This patient was so motivated and so fired up when she came in to see me. She said that she's heard wonderful things about us in the community. She's a mother of 2 kids.
She's already in great shape, though.
Already in great shape. She works out all the time. She does crunches, but she just could not get rid of this, Randy. The side view speaks volumes, okay?
Wow, okay.
So after the pregnancies, she got stretched out. We were able to reconstruct her abdominal wall, did just a tiny bit of liposuction to sculpt her waistline. You see the waistline before and after. So that sculpted her butt. Her butt really shows up well, and also her abdomen is totally flat.
So it's totally fit.
Exactly. And the key is, I mean, reconstructing.
But let me ask you a question. I mean, isn't she just sucking it in here in the after?
Absolutely
not.
not.
So you pulled in, tightened the ab muscles.
Yes, and I have my patients tighten their abdominal muscles on side view, and I take one shot and then a relaxed shot where they're not sucking it in. And the most important thing I can tell you is that on average, I tighten these people probably 10 centimeters, which is about 5 inches, okay? Now, what does that do for them? That
it's like a girdle.
Exactly. It creates an internal girdle, and what it does for them is it actually revs up their metabolism, and it changes their eating habits. If they can eat 1 full bowl of cereal before surgery,
they feel full faster.
Immediately after,
they
feel full. So what it forces them is to eat 5 to 6 times a day. Now, Randy, I think my favorite photo is the frontal view on her, because let me show you this. Her belly button, focus on her belly button in the before picture. It was kind of sad. A lot of extra skin around it from the stretch of pregnancy, and the belly button that we were able to create for her immediately after surgery was just so beautiful. The other thing is that you have to look at is her waistline is now sculpted. Very important.
So this was
ladies.
a tummy tuck?
This was a liposuction of the flanks and the
So just liposuction on this person,
right?
And a tummy tuck.
Absolutely, I did a tummy tuck.
So I don't think of a tummy tuck on somebody that because she had that stretched out.
She had that pooched
So when you
abdomen.
see a stomach that bulges out, what you're saying is the muscles have come apart, and then you put them back together a little bit.
Absolutely. You plicate it, you put it back together.
She's got to be happy.
More importantly, this patient is so motivated now. We referred her to Mike Emery, who's our personal trainer for our practice. He's actually my personal trainer, great guy.
You have a personal trainer?
He's got me doing boot camps.
Because you're in good shape.
Thanks. He's kicking my butt. I have to be in good shape to keep up with you.
To keep up with me. Good luck. You're going to have to get up a little earlier for that.
Let me show you another patient. This young lady has not had any kids, okay? But she just had a little bit of extra fat all over. And she just wanted to have a more sculpted look. She just wanted to be in shape. So she came in, I did liposuction of her abdomen, axillary lines, bra line, and also her full back. Now look at the before and after on the waistline. That love handle area, that muffin top, so to speak, is gone. Okay.
She has shape now. Looks good.
Exactly. Now moving on to the oblique view, I think it's very important to appreciate in the oblique
that
view.
Looks different.
She looks athletic. What happens is these patients, they get motivated after the fact, they start working
I mean, you take
out.
somebody, what's amazing, and I don't think anybody could disagree with this, you take somebody that looks maybe just a little out of shape, a little sloppy, and then you turn them into somebody that looks like a fitness person.
You know what? Thank you so
like
much.
A fitness athlete. Very good.
That's a very kind compliment. And, you know, that's what I shoot for, and it's very important. And again, you know, you have to look at the smoothness of the skin. these patients have good results without looking lumpy bumpy. Look at the rear view on this patient. So what I did for her is her love handles, her back area, but also we did her hips and her inner thighs and her outer thighs, and also the sort of the back of the thigh area. What I think is important about the back of the thigh, or the banana roll, a lot of patients come in and see me about the banana roll.
What's a banana roll?
It's sort of like an extra roll right below the buttocks.
Okay.
That sort of, as the buttocks fall, it causes an extra crease in there. What I do for that area is I liposuction, but I turn off the suction. So I'm actually just lipoing, and I separate the skin from the underlying muscles, and it's very important. And then we put them in a compression garment, and then that skin gets redraped as it heals. It heals very smoothly to the muscles, and then we send them to Johanna for endermology, and she smoothens them out.
Now, you know, at the top of the show, you said that you can give them a younger looking body, okay? Now, I think on this rear view, people would, you know, before, I mean, it looks like she looks like a, you know, in her late teens on the after.
Yeah, I think this patient is actually in her mid 30s, and I think, you know, after this, she looks to be in her maybe mid to late 20s, and she, you know, she's really enjoying
Okay, we have time
results.
for a few more.
This patient, very important. She came to me, and she was so depressed about her abdomen. She hated her abdomen because of the stretch marks.
Because she's pretty much fit everywhere else, just that ab.
Absolutely. She works out, and she does crunches. And
It's a mommy makeover?
Well, I did only tummy tuck. She did not want any breast work done at that time. She's actually coming back to us for some breast work now.
All right.
But at that time, when I took these pictures, I had only done tummy tuck and liposuction of her back. What was very important is the key word that came out of her mouth is that she felt like she had a jelly belly. Everything was loose.
Jelly belly. Okay.
Yeah. Okay. Now, she obviously did not even want to appear in intimate situations, and also did not want to go to the beach in a bathing suit or a bikini, things like that. Now, look at what we were able to do for her after the fact. The majority of the stretch marks are gone. More importantly, her body's tight. Her abdomen is tight. You can see that she
Great
has
belly
very
button, by
athletic
the way. I mean,
lines.
you're known for the belly button, a natural-looking belly button.
Actually, let me tell you about my belly button. I would say 45 minutes of my work is dedicated to my belly button. And the belly button is so important to us.
Because I feel like I could spot, after meeting you, I felt like you taught me what to look for in a bad tummy tuck and a good
surgical.
I feel like I could see that smeared belly button. This is very nice.
Right. You have to make the belly button you have to make it small. Very important.
Yeah, wow.
Now, on side view, I think this lady really enjoys her results on side view because she looks very athletic, and her waistline really got sucked in.
It gives them a shape. It gives them a shape back. I mean, a very fit look.
Absolutely.
Very sexy.
I got to point out to you what's very important that I haven't had a chance to touch upon is when I do the liposuction, it's very important to do the liposuction of the back and flanks, not only to suck out the fat, but more importantly, it's important to get that skin separated off the muscles, okay? When the skin is separated off the muscles off the back, it's loose. It's like you're wearing your shirt loose, and then you suck it into the medial area so that that waistline sucks in, and then you pull that extra skin down and you cut it out. So in essence, we're talking about a multiple direction approach, in and down, like
Was this a tummy tuck as well?
Absolutely. That was a tummy tuck and a liposuction.
Now, by the way, a lot of guys, you know, I meet, you know, I'm more confused than ever probably. I mean, I meet plastic surgeons, and a lot of guys don't like to do lipo with a tummy tuck.
Yes.
You're not afraid of that?
No.
Because you say without it, they become blocky.
What happens is the incision is very important. You got to do a French bikini incision, which starts low above the pubic area and then kind of tapers up. Okay. The majority of surgeons do that horizontal incision, which is a flat line.
I do see that.
That flat line incision actually makes the patient boxy. My incision is anatomically correct
so it's kind of,
for the body. Exactly.
I'm sorry, it goes this way?
It's like a smiling face incision.
So why would they go straight across then? Why does it, I mean, logically it makes sense.
Because honestly, surgeons don't think, they don't analyze their work, they don't analyze their pictures, they don't think about what they do, which is a big pet peeve for me.
I mean, some do, some don't, obviously.
Yeah, and that was something that I really wanted to teach my medical students and residents at the University.
Very nice. I mean, the front view. Do you have them bring in their own bathing suits, by the way?
Absolutely.
So it fits them?
Absolutely. Now, let me just point something out to you. Look at this patient's waistline, okay? Her
on the side view here.
On the side view. What happens is the love handles are very sculpted now. They're very tight, okay? There's no dog
like a
ears.
girdle effect.
And her buttocks have been sculpted, okay? So this patient...
You sculpted her buttocks?
Yes, actually I sculpt all of my buttocks. So This patient, after the fact, actually has a butt, and the jeans that they wear just makes them look so good and curvaceous. Very important.
Are you of the opinion that when you see a person in their 40s and they look good out and about, that chances are they were one of your patients in the desert?
No, no. There's a lot of people that have just
I'm kidding
good
around,
jeans
by the
and-
way. I'm kidding around. But listen,
Thank you.
hey, always a pleasure having you on the show.
Thank you.
Great photos, great work. I think you're getting better, or maybe you're just getting better photos, because I know some people just don't want to give you their photos.
Thanks.
Right?
I appreciate it.
So,
I'm always working hard to get better.
I want to thank you for coming on the show.
Thanks,
Very good.
Randy.
Always a
Appreciate it.
pleasure.
Thank you.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this again online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.